Hello and welcome to the ASCO Guidelines podcast series, brought to you by the ASCO Podcast Network, a collection of 9 programs covering a range of educational and scientific content and offering enriching insight into the world of cancer care. You can find all the shows, including this one, at asco.org/podcasts. My name is Brittany Harvey, and today I'm interviewing Dr. Linus Chuang from Danbury Hospital and Norwalk Hospital, Nuvance Health in Connecticut and New York, co-chair on Management and Care of Patients with Invasive Cervical Cancer, ASCO Resource-Stratified Guideline Rapid Recommendation Update. Thank you for being here, Dr. Chuang.
Thank you for having me.
First, I'd like to note that ASCO takes great care in the development of its guidelines and ensuring that the ASCO conflict of interest policy is followed for each guideline. The full conflict of interest information for this guideline is available online with a publication in the Journal of Clinical Oncology, Global Oncology. Dr. Chuang, do you have any relevant disclosures that are directly related to this guideline topic?
No, Brittany.
Thank you. Then talking about the content of this publication. So what prompted this rapid update to the management and care of patients with invasive cervical cancer ASCO Resource-Stratified Clinical Practice Guideline, last published in 2016?
ASCO Rapid Recommendations Updates highlight revisions to ASCO Guideline recommendations on management and care of women with invasive cervical cancer, the ASCO Resource-Stratified Clinical Practice Guideline that was published in September of 2016. We revised the guidelines to reflect new and practice-changing data on the use of pembrolizumab combination therapy in patients with metastatic, recurrent, or persistent cervical cancer in enhanced and maximal settings.
Great. Then based off this new data for the pembrolizumab combination therapy, what are the updated recommendations from the guideline panel?
Based on this recently published report about the Keynote 826 study, the checkpoint inhibitor pembrolizumab, alongside standard chemotherapy with or without bevacizumab as first-line therapy, significantly improved the overall and progression-free survival in patients with persistent, recurrent, or metastatic PD-L1 expressing cervical cancer.
Great. Thank you for providing that recommendation. So what should clinicians know as they implement these recommendations, and for which settings do these recommendations apply?
This trial included 617 patients, pembrolizumab 200 mg delivered intravenously every 3 weeks in combination with standard chemotherapy and with or without bevacizumab for up to 35 cycles is worth emphasizing based on the following study results. The median progression-free survival was 2.2 months longer in the pembrolizumab group that have a PD-L1 combined positive score of 1 or more. And the progression-free survival at 12 months was also longer by 20% in the pembrolizumab group when compared to the placebo group. The overall survival rates at 12 and 24 months were higher in the pembrolizumab group, 75% and 53% respectively, compared with the placebo cohort, 63% and 41% respectively. According to the study, the most common adverse reactions, which occur in more than 1 in 5 patients in the pembrolizumab group, and they are anemia, neutropenia, alopecia, and peripheral neuropathy. Based on this data, our rapid communication recommended this regimen be used in the enhanced and maximal settings where the pembrolizumab is available.
Great. Thank you for reviewing that data and the context of this recommendation. So how will these guideline recommendations impact patients?
So pembrolizumab with the standard chemotherapy with or without bevacizumab demonstrated improvement in the progression-free and overall survival, much longer than those without the pembrolizumab group. And this has emerged as a frontline therapy for the group of patients that have persistent, recurrent, or metastatic cervical cancer with PD-L1 expression cervical cancer.
Okay, thank you. And then finally, what emerging evidence is the panel anticipating regarding treatment of invasive cervical cancer?
This is an exciting time. Exploration of other PD-1 and PD-L1 inhibitors, monotherapy, or as part of combination therapy for cervical cancer will expand the management of patients with recurrent or metastatic cervical cancer that progressed after platinum-based chemotherapy. It is also important to explore the ability of pembrolizumab with chemoradiation with or without concurrent and maintenance pembrolizumab to improve outcomes for patients with high-risk, locally advanced cervical cancer.
Great. That's very exciting to see that evidence coming to fruition. So I want to thank you so much for your work to rapidly update this guideline and for your time today, Dr. Chuang.
Thank you for having me today.
And thank you to all of our listeners for tuning in to the ASCO Guidelines podcast series. To read the full guideline, go to www.asco.org/resource-stratified-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app, available in iTunes or the Google Play Store. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.